Well, hello. I will be chatting about the thyroid involvement in and how it impacts hair loss and weight gain. A lot of this stuff maybe you know already, but I'm hoping that you'll be able to grab some takeaways from from the webinar. The whole point of this webinar today is going to be a dive into whether your thyroid is causing your hair loss and weight gain. And this is the agenda for today's webinar. So we'll go through the problems, some overlapping conditions that can also present very similarly. We'll go into how the thyroid functions and the right testing that you will need to request from your healthcare provider or family physician. And lastly, we'll go through a roadmap of how I approach thyroid conditions. So the last part of the webinar will be answering questions. And if any questions come up over the course of the webinar, you can just put your questions into the chat function and I'll go through them at the end. So a little bit about myself and my practice. So I am a licensed naturopathic doctor. I see patients all over Ontario. And the reason why I chose to focus in women's health is because I've discovered that there's such a need for women to receive more of an integrative healthcare model in terms of approaching their hormonal concerns, fertility concerns, and metabolic concerns. Because more often than not, when patients come to see me, they tell me that they weren't given very satisfactory answers or solutions to their concerns, or they were dismissed. But I want you to know that you deserve to be heard and you deserve to have your health concerns taken seriously. And it's my hope through this webinar that you'll become empowered to advocate for yourself and to demand the care that you need to be able to feel better and to get back to living your best life. So the reason why we're all here today is because you may have been experiencing or noticing hair loss that's more diffuse in nature, meaning that it's occurring all over the scalp. It's rather than localized, such as in the case of alopecia. And after showering, bathing, combing, brushing, you're noticing more and more hair coming out. You may also notice more hair on the floor as well. And, despite not changing anything, not changing the way you eat, exercising, everything else is consistent, but you're still noticing that weight gain coming on, and it's coming on, packing on towards the middle and the midsection, and it's becoming more and more stubborn, coming off. So the causes for this are plentiful, but I'll go through some of the most common underlying causes for the hair loss and weight gain picture. So in my work with my patients, I've identified the top 4 contributing causes to both hair loss and weight gain. The first being the nutritional deficiencies. So iron is a big nutrient that will be important for us to monitor going onward. There's also the issue of blood sugar dysregulation or insulin resistance. Hormone insufficiency, particularly where estrogen is concerned, can also precipitate hair loss and weight gain, as well as other body composition changes. And then finally, the focus of the webinar today will be on the thyroid, being able to recognize when your thyroid may not be functioning as it should, and to know what type of testing you need in order to diagnose a hypothyroid or underfunctioning thyroid condition. So many of the causes that I have already mentioned do overlap with thyroid symptoms, but the first one is iron deficiency. So oftentimes you'll see on a lab report that your doctor has requested ferritin. That is the storage form of iron. And in Ontario, the reference range for iron is between 15 to 272, but what's actually optimal is being between 60 to 100. And this is where I find some of my patients are in a state of disservice, is because they may have iron levels that are within that normal reference range of between 15 to 272. They're sitting around 30, but because their iron is considered normal, they're not given any recommendations for supplementing. But we know that low iron levels or iron deficiency can be a huge contributor to hair loss, to fatigue, and cold intolerance, which are symptoms that do overlap with low thyroid function. So it's really important that we repeat iron stores because it's also important and necessary as a nutrient to integrate iodine into the thyroid hormone production pathway. So it's important that we treat iron deficiency even if we are medicated on for your thyroid condition. So the second common cause is insulin resistance, and this is a condition that precedes the development of diabetes. So in insulin resistance, the insulin receptors that are on your cells may not be sensitive or may not recognize the fact that insulin has bound to it. And because of that, instead of the sugars coming from your diet being utilized within the cell to produce energy, the sugars remain outside of the cell. And this is usually when we see more of that storage kind of picture where these excess nutrients are being converted into fat for storage because they're not being utilized efficiently. And it's this storage or anabolic predisposition that affects or contributes to the weight gain type picture that is common between insulin resistance and hypothyroidism. And insulin resistance also predisposes women to additional states of hormone imbalance, which can present as acne, hair loss, and polycystic ovarian syndrome, in which ovulation is not occurring regularly. And insulin resistance can also impair the conversion of inactive to active thyroid hormone. So it's something that I also like to rule out when we're suspecting a hypothyroid picture. So something to note about insulin resistance is that it is very often underdiagnosed because in traditional screening lab work, doctors will test for overt markers associated with diabetes, and that's the HbA1c and fasting glucose. So if these two markers are elevated, you will likely be sent in for additional testing and be prescribed treatments or medication to treat the type 2 diabetes. But using a calculator, which I will go through later on, we're able to actually identify the insulin resistance even before we've developed diabetes. So hormone changes are another factor that can contribute to thyroid dysfunction and has overlapping symptoms with hypothyroidism as well. So sufficient estrogen levels are necessary for healthy thyroid function. However, as we approach our 40s and beyond, there is a decreased amount of estrogen production that goes on in our bodies. And this low level of estrogen also contributes to an ovulatory cycles where there's less egg and follicular development, so we're not releasing an egg on a monthly basis as we used to. And this hormone insufficiency state can contribute to the hair loss, weight gain, and fatigue that we see in hypothyroid conditions. And lastly, low thyroid function is one of the more common underlying causes that tie in the symptoms of hair loss and weight gain. So the thyroid is responsible for producing thyroid hormones, in particular T4 and T3. The most common cause for an underfunctioning thyroid is Hashimoto's thyroiditis, and it is autoimmune in nature. So thyroid conditions are actually way more prevalent than I think most of us realize, and about 5 to 10 pounds of weight gain can actually be contributed to inadequate thyroid function. So why it's important for us to look at and to assess the thyroid more closely is because the thyroid will be responsible for regulating your basal metabolic rate, which is the rate at which your body and cells are utilizing nutrients to produce energy. So in low thyroid function states, we actually see a reduced BMR, which contributes to weight gain and that positive energy balance. All right, so the main reason why we're here is to learn more about the thyroid and how we can treat a thyroid that isn't working as efficiently as it should. So these are the main functions that the thyroid governs. And as you can see, these are mainly functions that help to support survival and the activities that are important to sustain survival and vital organ function. But you'll see that one of the important functions is to produce the thyroid hormones T3 and T4. So as I mentioned before, thyroid conditions are actually much more common than most of us realize. About 20% of Canadian women have a thyroid condition. And about half of these women will have an underfunctioning thyroid, where they are producing less than ideal levels of thyroid hormones, T3 and T4. So what's really interesting about these thyroid hormones is that they help to support keratinocyte production, and keratinocytes are the cells that comprise the hair strand. And so when T4 and T3 levels are low, we see a greater degeneration of these cells, and that's why we see more hair fallout when our thyroid isn't working as it should. And because the thyroid helps to regulate basal metabolic rate, they can also help to stimulate and upregulate metabolism when hormone levels are sufficient, but we see the reverse when thyroid hormone levels are low. So there's more of a sluggish and slow metabolism associated with hypothyroidism. These are the common symptoms associated with a low functioning thyroid. And as you can see here, the symptoms span across multiple organ systems. There is also a lot of overlap between conditions that we looked at previously, such as iron deficiency, hormonal imbalances, and insulin resistance. And so this is an opportunity for us to utilize proper testing, lab work, and diagnostics to be able to tease apart what's going on, what's contributing to your symptoms, so that we're able to properly target the root causes. So one important thing to note is that even though your thyroid may be underfunctioning, there can be a potential for thyroid nodule growth, and that's what a goiter is. So oftentimes, women will notice growths that are fortunately benign, but it's something that should be properly assessed. And it's something that I recommend getting an ultrasound for. All right, so underlying causes that can contribute to low thyroid function. The first one is the autoimmune variant of hypothyroidism, which is Hashimoto's thyroiditis. Even an upper respiratory tract infection can cause a temporary inflammation of the thyroid gland, which can lower thyroid hormone production. Women who have undergone treatments for overactive thyroid or increased thyroid activity, such as radioactive iodine, may experience an increased destruction of those thyroid cells. And because we have less thyroid to work with after a thyroidectomy, where part of or the entire thyroid gland is removed, we see reduced thyroid hormone production. Certain medications, such as amiodarone, which is an antiarrhythmic medication for people with heart arrhythmias, as well as lithium, a common first-line treatment for bipolar disorder. These can precipitate low thyroid function. And then we also see postpartum thyroiditis, which is a temporary inflammation of the thyroid that 3% of women will experience after giving birth. And then there's also iodine deficiency, because iodine is required within the thyroid hormone production pathways. But iodine deficiency is actually very rare and very uncommon in North America because of our iodized salt. So when we looked at the symptoms and the overlap between the thyroid symptoms and other conditions that we looked at, I stressed the importance of us undergoing the proper diagnostics to be able to tease apart which symptoms are being caused by thyroid and which may actually be caused by other health factors. So this right here comprises the entire thyroid panel. So you'll see TSH, T4, T3, the thyroid antibodies, as well as reverse T3. So many of these tests may look unfamiliar, and that's because most of us will only receive TSH as part of our annual health screening lab work. Many of us won't have ever been tested for the thyroid hormones or the antibodies. So if you look at TSH, it's being produced by the pituitary gland, but it doesn't actually tell us where or how the thyroid is actually functioning in terms of its production of thyroid hormones T3 and T4, which are more downstream from the pituitary gland. And the presence of antibodies will also be a significant part in diagnosing the thyroid condition and teasing it apart from other autoimmune conditions. So typically for individuals who have hypothyroidism, we'll see an elevated TSH. And for me, an elevated TSH is anything above 2.5. So I have a ranges for optimal levels of TSH and the other thyroid tests that comprise the thyroid panel. So any TSH that is above 2.5, I'm already suspicious of and do suspect a hypothyroid disorder. So it's important for us to look at the thyroid hormones as well. So these ranges are applicable for people who are currently medicated on Synthroid or those who are non-medicated. And these ranges are slightly different for those of you who are taking Cytomel, which is the synthetic T3 medication. So one important thing to note is even if you are currently on Synthroid, taking Synthroid for your low thyroid function, you may actually notice that you're still experiencing weight gain and hair loss. And that's because Synthroid contains only T4, and T4 is inactive. It needs to be converted into T3 before it can have its impact or exert its impact on your metabolism and energy production pathways. So something I like to go through with my patients is calculating their conversion status. And I will use their free T4 and free T3 blood levels and divide the free T4 by the free T3. And the ratio will tell me whether or not they're converting the inactive to active thyroid hormone properly. So an ideal ratio is around 3 or slightly below. And then a conversion issue is usually indicated by a ratio of greater than 4. So in cases where my patients aren't converting their Synthroid properly, I usually recommend adding in some additional selenium or perhaps discussing other medication options with their doctor so that they can reap the benefits from their medication. So thyroid antibodies are super important for us to test because they actually precede the development of overt hypothyroidism by 7 to 10 years. So the presence or elevated presence of these antibodies can actually increase the risk of future development of a thyroid disorder. And they themselves can contribute to the symptoms associated with low thyroid function, such as the fatigue and hair loss. And what's really interesting about these antibodies is that the anti-thyroid peroxidase is less specific because it can be elevated in hyperthyroidism or overactive thyroid as well. However, elevated antithyroid globulin is usually indicative and more specific for Hashimoto's thyroiditis. So the presence of these antibodies usually do point to more of an autoimmune variant of hypothyroidism, but if your doctor is only testing you for the anti-thyroid peroxidase, we'll need to discern whether you actually have a hyper or hypothyroid picture. So lastly, rounding off the thyroid panel is reverse T3. And the reason why reverse T3 is important is because it actually competes with active T3 in binding at the thyroid receptors. So what this means is that it effectively blocks T3 from working and prevents the effects, the beneficial effects on metabolism and energy expenditure. So when we see an elevation of reverse T3, we can actually surmise that your hypothyroid symptoms are persistent, even if your T4 levels are normal. And the reason why T3 becomes elevated is when your body is under chronic stress, and that can be through mental, emotional stress, dieting, or severe caloric restriction, low iron levels, low levels of cortisol, such as in the case of Addison's disease, and diabetes, which is unfortunately a very pro-inflammatory condition. And then in addition to the thyroid panel, I also like to look at the other contributors to the symptoms overlapping with hypothyroidism, such as the hair loss and weight gain. So the first grouping is fasting insulin and glucose. And I like to plug these two values from blood work into a calculator called the HOMA-IR. It spits out a ratio that signifies the presence or the severity of insulin resistance. So the optimal ratio is between 0 to 2. Early insulin resistance is indicated by a ratio of greater than 1.9, and then severe insulin resistance is indicated by a ratio greater than 2.9. So as I mentioned earlier, the HOMA-IR calculator gives us an opportunity to be proactively to be proactive in terms of regulating blood sugar levels even before we develop type 2 diabetes. So there's a window of opportunity for early intervention here. And that's why the early detection becomes that much more important. So the inflammatory markers, ESR and CRP, also become important because they can signify the early development of autoimmune conditions such as lupus or Hashimoto's that can contribute to metabolic changes. And then there is salivary versus blood cortisol that I prefer because it allows us to map how your cortisol levels are fluctuating throughout the day. And it's typically with elevated cortisol that I see more of the weight gain type picture because high cortisol tends to put our bodies into storage mode. And that's why we see the triggering cravings for fatty foods or sugary foods, which tend to be more calorically dense. And these nutrients are then stored for later use. So whenever I'm working with someone who's really concerned about stubborn weight loss or unexplained weight gain, I do like to look at cortisol. And then finally, there are nutrient deficiencies, which we did touch upon earlier, such as iron, B12, and vitamin D, which can cause hair loss as well as fatigue, which are common symptoms also associated with thyroid dysfunction. So now that we've gone over the testing, I wanted to walk you through what my approach is, what my approach looks like when working with someone to help to promote healthy thyroid function. And of course, these steps in the roadmap are contingent upon the proper diagnostics and testing so that we're able to really pinpoint where the issues are coming from to be able to target the strategies appropriately. So the first step is to reduce inflammation because the thyroid, unfortunately, is extremely sensitive to levels of inflammation in the body. When the body is inflamed, the thyroid becomes inflamed as well, and it tends to function less efficiently in terms of its production of thyroid hormones, which, as we now know, are very important in the regulation of your metabolism. So these are a few lifestyle changes or modifications that can be helpful to reduce systemic inflammation. So regular exercise, a combination of both aerobic and resistance type training for at least 150 minutes a week can be helpful. Any stress reduction strategies such as meditation, going to therapy, and moving, staying hydrated to flush out toxins, which can reduce the inflammatory burden. And the amount of water that you need to drink will vary from person to person. But a ballpark that I like to recommend to my patients is about 1 ounce of water for every 2 pounds of body weight. And a way that you can monitor your hydration status is to look at your urine. So urine that is dark yellow, darker in color, or you're noticing that you're going to the bathroom less frequently, that's usually a sign that you need to drink more water. But on the flip side, if you are noticing very clear, colorless urine and you're going more often than that's typical for you, then that's usually an indication that you're drinking too much. And so you can take that as a sign to cut back. Alcohol and smoking, pretty self-explanatory in terms of increasing that inflammation burden. And then also maintaining healthy weight, reducing insulin resistance, or identifying any medications that can contribute to weight gain, such as SSRIs, which are a common medication class used to treat anxiety and depression, or even the oral contraceptive pill can contribute to weight gain and stubborn weight loss. So it's important that we rule out the other possible factors that are contributing to your symptoms. And then finally, getting enough sleep. So that is at least 7 hours. Many of us may feel like we can survive on less, but sleep deprivation, which is actually defined as less than 6 hours of sleep, can increase the levels of inflammatory markers, which can adversely impact the function of your thyroid. So with nutrition, I always stress the importance with my patients of consuming enough protein because it is the one macronutrient that can really help to speed up metabolism, as well as regulate blood sugar and reduce insulin resistance. So my recommendation is to consume at least 1.2 grams of protein per kilogram body weight. I also am a big supporter of the Mediterranean style of eating because it really focuses on high fiber foods, fewer refined sugars, more lean meats, and healthy plant-based fats as opposed to the saturated and trans fats found in red meat. The DASH diet is very, very similar, but it does have a tighter restriction on the amount of sugars and sodium that you can consume daily. And this variant of the Mediterranean diet is often prescribed to individuals who are at high risk for the development of heart disease or those who are currently dealing with heart disease. So low glycemic index foods become important because these are the foods that will contain carbohydrates that will release sugars more steadily into the bloodstream compared to refined sugars. So this helps to prevent those insulin spikes that can promote insulin resistance. And then finally, identifying any food sensitivities. So typically people with thyroid conditions will tend to respond more adversely to gluten, even if they are not celiac. And dairy also is a very common inflammatory trigger as well. I don't always recommend a food sensitivity test because if your body is inflamed, we need to work on that first because there is a higher prevalence for false negatives on those tests. So I usually recommend trialing an elimination of gluten and dairy first, and then seeing how that impacts your thyroid function. These are the triad of supplements that I often prescribe to my patients to help with their thyroid function, and in particular with the conversion between T4, T3, as well as reducing thyroid antibodies in cases where my patients are dealing with Hashimoto's. So selenium is a mineral that I love using because it really helps to convert inactive thyroid hormone to active thyroid hormone. It's also super important in antioxidant pathways because it supports glutathione production. And it also works to lower thyroid antibodies. So selenium is great because it also helps to re-regulate the way that your immune system works. Vitamin D, super important because vitamin D deficiency actually is associated with an elevation in thyroid antibody. So we in North America, especially in Canada, are very prone to being vitamin D deficient because even during the summer, when we're exposed to more sunlight than usual, our bodies really don't make enough vitamin D, and that's why supplementing is crucial. So vitamin D helps to re-regulate the immune system so that we have less of that antibody production and less of the body attacking its own tissues. So I always like to incorporate vitamin D as part of any thyroid health support plan. And finally, there's inositol, which is a sugar alcohol, which not only helps to reduce thyroid goiter size, lower thyroid antibodies and TSH, but it can also be very helpful to support insulin sensitivity in cases where my patients are dealing with both. So I find that this combination of three nutrients can be really effective in terms of supporting healthy thyroid function for the long term. The dosing for each of these nutrients is very individualized because I do take into consideration, any comorbid health conditions they're dealing with, any medications that my patients may be on, so that we avoid any adverse nutrient medication interaction. And then finally, the last step is identifying the need for medication. So typically, when I see elevated levels of TSH, usually that is above 3, I will send a referral for my patients to receive medication from their doctors. And there are 3 different types of medication that are commonly prescribed for cases of hypothyroidism. And the first being levothyroxine, which then most of you may have heard of already or know someone who is on it. It is a form of synthetic T4. And as you now know, T4 is inactive. It needs to be converted into T3 before we're able to reap the benefits from its metabolic action. So this conversion usually takes place in tissues such as the liver, kidneys, the gut, as well as muscles. But for those of you who are dealing with conversion issues, it's likely that your doctor may actually prescribe the liothyronine, which is synthetic T3, on top of the levothyroxine to help with the conversion. So these 2 medications are only available for prescription through medical doctors and specialists. However, I do utilize natural desiccated thyroid in my practice, and I find that it's quite similar in efficacy in comparison to Synthroid or Cytomel without having as many of the adverse effects associated with it. So NDT is the actual thyroid gland extract that's derived from a porcine source, and it contains both active T3 and T4. So we're able to combine both of these thyroid hormones, and it's similar to what I would call a thyroid hormone replacement. So for NDT, we're able to exert strict tighter control on dosing because I can prescribe my patients a specific dose based on where their blood levels are, or we can utilize preformed generic formulas that come in 30, 60, and 125 milligram doses. So whether you are on medication or not, it can be something that may be important for us to consider and to incorporate if you're still struggling with hair loss, weight gain, and we've identified a decreased function in how your thyroid is working. So now that you have learned more about how your thyroid works and the role that it plays in regulating your metabolism, body composition, and its impact on hair loss, I hope that you are better equipped with tools and information that you can use to advocate for yourself when you are working with other healthcare providers. And I think that it's really important to, go into any health conversation with the knowledge and with knowing, what it is that you need to ask for in terms of testing, because in the 3 minutes, maybe 5 minutes that you get to spend with your medical doctors, you might not have enough time to actually go through the entire history of your complaint. But don't let that deter you or discourage you, because you now know what your options are. And I hope that you're empowered with this newfound knowledge to be able to kickstart your health journey towards healthier metabolism and hormonal health. All right, so I am currently taking new patients at Naturopath Living, and I have my email here for you if you'd like to reach out with any questions. I am in office on Sundays, Mondays, and Fridays, and I'd love to meet you and to work with you if I haven't already.